Hello everyone, you are watching Dr. Akinclicks and I am Dr. Akin. India has been at the forefront of fighting against COVID-19 disease, and India is one of the early nations to roll out vaccine against COVID-19 disease. In the second week of January 2021, India rolled out vaccines against COVID-19 disease for its population. Covishield and Covaxin were rolled out for the population of India. And initially, the first priority was given to healthcare workers across the country to get themselves vaccinated against COVID-19 disease. The second priority is given to frontline workers. Those are especially the municipal workers, the paramilitary forces, the police, the defense forces of the country. And there have always been demand for allowing the private sector to vaccinate the people. So government has now roped in the private healthcare providers from the 1st of March 2021 to vaccinate the people, those who are eligible and those who are willing to get vaccinated in their healthcare facilities, especially in private healthcare facilities. Those are any of the private healthcare facilities like hospitals, health centers, and any of the health delivery points. So with the involvement of the private healthcare facilities, more and more numbers of people are expected to get vaccinated in India. In this phase of vaccination against COVID-19 disease, in which the government health facilities and the private health facilities are involved, government has laid down certain rules. The first rule is that person above 60 years of age shall receive vaccination. The second is that person who are 45 years and above with comorbidities shall receive the vaccination. Today I am going to tell you what are the comorbid conditions that the government has listed out. Please watch this video till the end so that you will know what are the comorbid conditions that the government has listed out. There are 20 comorbid conditions which the government has listed out for the citizens to know, and then to get a certificate of comorbid conditions from your treating doctor, and then take the comorbid conditions certified by your treating doctor to the registration center and get yourself registered. And you may get vaccine at the site itself when you are registering, or if there is huge rush of people wanting to get vaccination, government or the healthcare facility may list you in the priority and intimate to you WhatsApp messages when is your date of vaccination. So come along with me to know what are the 20 comorbid conditions that the government has notified for prioritizing those people who are 45 years and above to receive the vaccine against COVID-19 disease. Now I am going to tell you the comorbidities that the government has notified for 45 years of age and above to get the priority of vaccination against COVID-19 disease. So here we go. Watch the video till the end carefully. Government has said that presence of any one of the following criteria will prioritize the individual for COVID-19 vaccination. Number one comorbid condition that the government has laid out is heart failure with hospital admission in past 1 year. Number 2, post cardiac transplant or left ventricular assist device. Number 3 is person having significant left ventricular systolic dysfunction. Ejection fraction should be less than 40%. The next is moderate or severe valvular heart disease. The fifth comorbid condition that has been laid down by government is congenital heart disease with severe PAH or idiopathic PAH, pulmonary artery hypertension. The sixth comorbid condition which the government has prescribed is coronary artery disease with post-CABG or PTCA or myocardial infarction and hypertension or diabetes on treatment. The seventh comorbid condition is angina and hypertension or diabetes on treatment. The eighth point is CT or MRI documented stroke and hypertension or diabetes on treatment. The 10th comorbid condition which the government has issued is diabetes more than 10 years or with complications and hypertension on treatment. The 20 comorbid conditions which the government has notified, the 11th one is kidney or liver or hematopoietic stem cell transplant recipient or those who are on wait list for transplantation. The 12th comorbid condition is end-stage kidney disease on hemodialysis or CAPD. Number 13 comorbid condition is current prolonged use of oral corticosteroids or immunosuppressant medicine. The number 14 in the list of comorbid condition is decompensated cirrhosis. Number 15 comorbid condition is severe respiratory disease with hospitalization in last 2 years or with FEV1 less than 50%. Number 16 comorbid condition listed out by government is leukemia, lymphoma and myeloma. Number 17 is diagnosis of any solid cancer on or before 1st July 2020 or currently on any cancer therapy. Comorbid condition in the 18th number is sickle cell anemia, aplastic anemia, bone marrow failure, thalassemia major. Number 19 comorbid condition is primary immunodeficiency or persons having HIV infection. And the final number 20 comorbid condition issued by the government to receive priority in vaccination against COVID-19 disease is persons with disabilities due to intellectual disabilities or persons having muscular dystrophy or person with acid attack with involvement of respiratory system or persons with disabilities having high support needs and persons having multiple disabilities including deaf and blindness. I have explained the comorbid conditions which the government has listed out. There are 20 in the list. So if you have already these diagnoses in your diagnosis sheet as by any hospital, you can carry that document and go to the registration center and get registered, and the health facilities will prioritize you to receive the vaccination. Comorbid conditions certificate is required for those people who are 45 years and above until 60 years of age. Obviously and automatically the 60 years and above citizens will receive the vaccination at the vaccination center. So confused about your diagnosis, if you are confused in what category my comorbid condition will fall in, In that case, please take your medical documents and go to a nearest healthcare facility and get the certificate of comorbid conditions as listed by the Government of India. Hope that my sharing of the comorbid conditions, the 20 comorbid conditions as listed by the Government of India, you will have a fair idea of what are the comorbid conditions for the COVID-19 vaccination prioritizing. I feel that this video has been useful to you or has been useful to any one of your relatives. Please like this video. And I continue to bring regular latest updates on health and health related issues in a very simple way or in a very simple words, so that common citizen can understand and make use of this medical video. And if you want to get latest regular updates, and if you do not want to miss any of the videos which is shared in this channel, please like, subscribe and press the bell icon to receive regular notifications whenever I upload a new health related video on this channel.